Welcome back to Helping Today's Woman. In our last segment, as we ended, I told you we were going to look at some ways to fix the x-ray that we looked at. Now, we talked about some surgical and some non-surgical options in the last segment. In this segment, we're really going to concentrate on the surgical options. So I want to start off, again, I'm joined by Dr. Matt Barrett, who is a orthopedist at the Tennessee Orthopedic Alliance who specializes in joint replacement surgery. And Matt, one of the things I want to touch on in this one, if we start, there have been major advancements made in hip replacement surgeries. And I want you to give us a little bit of an idea of what's come on, because I know this is, a much different procedure than it even was 5 years ago. It's much more precise, much more better outcomes. Tell me a little bit about that.
Well, I think major advances come along maybe once every 10 years. I think there are minor advances that come along, yearly. But when I think of major advances, I think of changes in the way we put the parts in. Like, for instance, when hip replacement first started, the parts were glued in.
Right.
And then we went away from that because that failed, and we went over to cementless implants where there is no glue. That's a major breakthrough. It made a difference in years and years of survival. So that's a major advance. There's been major advances in the quality of the plastics that we use. Mm-hmm. Those have made tremendous differences in the longevity of the implants. And then there are minor advances. We've had computer-assisted surgery recently that has helped with alignment of implants, and hopefully that's going to translate into longer lifetime and lifespan of the implant. We've had minimally invasive surgery, and we still don't know what the long-term benefits of some of these newer things will be, but I would qualify those as minor advances compared to the things I mentioned earlier.
Interesting, because I would have thought you would say the computer-assisted was a major advance. So, as being an OB, I don't necessarily deal with this. I'm interested to hear you say you think that's a minor advance, and I understand the glueless is a huge advance. There's no question. I've heard that for a long time. All right, we're going to move on a little bit. I want to look at these. The next thing we're going to look at is some of the new implants, because we've got some implants here, and I want people to begin to understand a little bit about what these implants are and kind of how they work. So let's take a look at them. So describe to me a little bit what you got in your hand, first of all.
Well, this is the stem of a hip implant, and this goes down into the femur bone. It's kind of like a spike that goes into the femur bone. A ball mates with that stem and locks into place there. This cup is kind of like a metal sponge. The bone grows into that part, and that goes up into the old socket. And so then this is the hip replacement. So you have almost a frictionless environment there. And so this is a typical hip replacement with a metal ball on a plastic socket.
Interesting, because this is where, from what we were looking at earlier, this is your biggest issue, is this ball with basically this removed, so you're now on this metal part. Having the plastic allows much more motion of the hip, correct?
Well, this is where the bearing surface is. This is where the motion occurs. Now, we've got newer bearing surfaces, and we have polished metals so much that you can now place a metal ball on a metal shell.
Interesting. Okay.
And so this is a newer type hip replacement here, and so you have a metal ball that articulates with a polished metal shell, and so there's no plastic in this hip replacement.
Now, what's the advantage of this one versus this one?
Well, the proposed advantage is that the plastic won't wear out because there is no plastic. Historically, the plastic would wear out in a hip replacement, and the idea was to try to make something that wouldn't wear out. And so we came up with metal implants, metal on metal. We came up with ceramic implants, and this is a ceramic ball. And the hope is that those would wear less than metal on plastic.
Has that been proven, or do we know yet?
It has been proven somewhat, but the plastic has been improved so much that the wear of a metal on plastic is actually quite similar to the metal on metal and the ceramics.
Now that we've done our surgery, we've put one of these, whether it's metal on metal or metal on plastic, and they're coming out of the operating room. tell me what they can expect in that immediate postoperative period. What kind of things can they expect in those first couple of days in the hospital? What do they expect to be happening?
Well, typically, I allow my patient to rest that same day of surgery, and then the very next morning we get up and we start walking, and so we start physical therapy the very next day. We give pain medicine so that it's more comfortable, but therapy begins almost immediately with the hips.
And so how quickly, they're going to get up and walk probably the night after surgery.
They get up and walk the morning after surgery, and so there's very little downtime. You're up walking almost immediately.
That's great. Is that a change from the way we used to do them?
It really has. There's more emphasis on getting people moving quicker.
Well, and I know that's pretty much it. Even in my surgeries, people are surprised as to how quickly we get them moving. But I know that's been a huge issue, and it'll be a huge issue in survival rates and actually how patients do in surgery. You agree?
I would agree. You have less risk of blood clots and pneumonia and all those type things if you're up moving immediately.
Good. Now, next question is, how many days, a lot of people want to know, how long am I going to be in the hospital? If I have this procedure done, how long am I going to be in the hospital afterwards?
The average stay is usually 2 to 3 days, and an older patient may stay 3 days, a younger patient may stay 1 or 2 days, so a little bit of variation, but on average about 2.5 days.
Now, the other question I have for you, because we had this discussion before we went on, is some people will go home, some people will go to a rehab center, and some people will go to the outpatient center at Charles. Describe to me what patients can expect. The majority of your patients, do they go home? Do they go to a rehab center?
I think the most important factor on that is how debilitated the person was before the surgery. So if they were barely able to walk and were spending most of their time in a wheelchair, they may need to go into a rehab center for a while in order to get moving again. If they were able to walk and function, they very well may be able to do outpatient therapy, which is where you go home and then you get in your car and you ride to outpatient therapy 2 or 3 times a week. So there's some variation there.
And there are still people who will have physical therapy at their own home, is that correct?
Correct.
Because I know that's what my mom did. She had it actually at home and made it easier. The other thing is they also, I know in Dallas they offered occupational therapy because mom had some issues. People don't think about even grabbing things, getting up and down from the toilet. These are all issues that people don't think about with new hip replacements, but they're issues they have to think about, aren't they?
Correct. I have an occupational therapist see every one of my patients, and it just helps them get ready for being at home and being able to better take care of themselves and function.
Good. Now, we're going to take a break, and after these messages, we're very lucky to have a patient who has recently undergone this procedure. She's going to discuss with us a little bit about her experience with hip replacement surgery. We'll be right back after these messages.